Hi there, this is Paul Goff, leading UK physio. Here are my top tips on how to help improve your back pain and symptoms. There's two types of back pain that we talk about as physios. Number one is acute and number two is chronic. If you're in the acute phase, you've probably just done your back pain and symptoms in the last day or two, probably caused by excessive lifting, twisting or bending. For example, you might have been in the garden or you've been sat for too long and you've turned sharply. That's where you get that really nagging kind of sharp pain in the bottom of your back, and sometimes, to be honest, it can go down your leg as well. Number two type of pain is chronic, where you've probably had the pain and symptoms and stiffness usually for quite a while, and today or over the last few days, for whatever reason, the pain is a lot worse now. I'm going to give you advice on how to manage both, so please stay tuned. Acute injury, first thing you need to do is change your posture. Avoid sitting like the plague. Okay, and this is why I always tell my patients, you've got to look at changing your posture. You need to start standing a lot more or lying flat, but avoid sitting at all costs. When you sit, the pressure on your spine increases tenfold, but when we stand, the muscles that you've got in your spine will help protect you. So change your posture and start lying flat. And number two tip is avoid the temptation to curl up. When you go to bed, it'll probably feel really nice to curl up in what we call the fetal position, but I can guarantee you that it's making your problem worse. So avoid sitting and avoid curling up in the fetal position. Tip number three is ice. Really acute back pain responds very nicely to ice, so try and get to your freezer, get a bag of ice or an ice pack, whatever you've got, and apply ice every 2 hours for 10 minutes. Tip number four, get some anti-inflammatories as quick as you can. Ibuprofen's a good start, but probably make a quick trip to your GP and get something a little bit stronger like diclofenac or Voltarol, tramadol, something like that. Okay. And tip number five is, women, you're going to hate me for this, you need to avoid high heels. You need to be wearing something that's flat. So if you're heading to work tomorrow, and usually you would wear high heels, get rid of them as quick as possible and go for something a lot flatter and a lot softer and a lot more comfortable. And last thing you need to do, a little exercise that I can give you, is an extension exercise. Hands on your bum, leaning back, and that is what we call extension. If you think about it like this, when you sit, your spine curls and it flexes, okay, and that's poor posture. The spine likes to be in extension as much as possible, particularly for acute back injuries. So look for extension exercises, okay. Hands on your bum, 10 times, maybe every hour you can do that. So if you're heading to work today, make sure that you take regular breaks, at least every hour, to do these extension exercises. If you're in the chronic phase, these are the things that you need to be looking at. It's probably more heat and a little bit of gentle exercises to try and get rid of this stiffness and really acute kind of inflammation that you've got in there. The way you can do this is with heat and some gentle exercise. Go for a run, go for a bike ride, but keep it on the flat and keep it real low level and low intensity. And the long-term management of any chronic back injury is core stability exercises. These are Pilates type exercises which will increase the spinal control and stability, and really protect your spine and make it less likely that you'll suffer an injury in the future. We can give you advice on that. Please get in touch with me, paul@paulgoffphysio.com is my email, and we can very quickly email you some exercises to help with spinal control and stability. But in the short term, again, ice is very good, and anti-inflammatories will help you as well. So really they are the things that in the long term you need to be doing, and also in the short term as well. One other quick tip I can give you is to improve your sitting posture for chronic problems. We all do it. I'm guilty of it. Just about everybody you see at work tomorrow, today, will certainly have a poor position in terms of sitting. Get your shoulders back, get your bum back as far as you can in the seat to improve your sitting posture and take this pressure off your spine. Okay. Anything I can help you with, please feel free to get in touch with me. My direct email is paul@paulgoffphysio.com. And just before I do go, one interesting statistic I'm going to leave you with. On average, people wait 3 months before doing anything about their injury. And my bet today is that if your car broke down or your PC broke down, you would ring a PC repairman or a garage mechanic, probably today if not tomorrow. Which do you value the most, your back, your car or your PC? Please, wherever you are in the UK, do something about your back injury. Pick up the phone and speak to a physio, or at very least send me an email and I'll send you some exercises that can help. Thanks for watching, take care, and I'll speak to you again soon.